Right, we begin here. Professor Salim Abdul Karim says South Africa's COVID-19 curve is different to that of other countries. He says daily infections stopped increasing exponentially since the lockdown.
Every country, once they've reached about 100 infections, they have virtually a non-stoppable epidemic. They have this rapid exponential increase in the number of infections. Next slide. But the South African epidemic has been slightly different. Next slide. And what we're seeing instead is that in the South African epidemic, we were poised to get this rapid increase. And it increased up to the 26th of March. On the 26th of March, the day we instituted the lockdown, the epidemic curve turned. What happened is that the number of cases declined and we went into a plateau. Next slide. And this becomes more clearer when you look at the number of new cases each day. In other words, don't look at it cumulatively. Just look at the absolute number of new cases. And if you look at the moving average, what you see, again, is that the number of new cases increasing rapidly until you get to the 26th of March, and then it turns. It turns, it heads back down, and it gets to a sort of plateau level.
At the same time, the low number of infections in South Africa is not due to the small amount of tests conducted thus far. This is according to the chairperson of the COVID-19 Ministerial Advisory Committee. Professor Salim Abdul Karim admits, however, that more tests need to be carried out.
Over the 2 weeks in which we saw the South African epidemic go into a sort of plateau phase, what we see is a continual increase in the number of tests that are being undertaken. So it's certainly that we didn't do much fewer tests. In fact, the overall numbers of tests have steadily increased in the last 2 weeks. So that eliminates that, it reduces the likelihood that it's just simply a problem of lack of testing. Lack of testing may be a contributor, but it's certainly not a dominant one. So are we not testing the poorer communities? Well, if we look on the right-hand side, that's the daily number of tests that are being done by the NHLS. The NHLS is the public part of the laboratory service. And so all of our poorer communities without medical aid will be coming to the NHLS for their testing. And what do you see? Just at the time that you saw the plateau in the South African trajectory is the point at which the NHLS sharply increased the number of tests that it's doing. And we've seen that steady increase in the number of tests in the NHLS. So it's not because we're not testing in the townships and the communities. It simply has to be a third explanation.
So this week is critical in deciding how to respond to and manage the coronavirus and the lockdown. This is according to the chairperson of the government's COVID-19 Ministerial Committee, Professor Salim Abdul Karim. Now, the coronavirus infections have increased to 2,272 in the country, with 27 people having died thus far.
So this coming week is critical. We need to know what the average number of cases is going to be. Why? Because we want to know what the community transmission levels are. Because we want to use that to guide us on what next steps we should follow and how we should manage the lockdown. So by the 18th of April, we will know if community transmission and whether our interpretation that community transmission has been kept low, whether that's accurate. And if we look at the 67 cases per day on average, the 95% confidence interval is 45 to 89. In other words, the true number of cases is between 45 and 89. So we are 95% confidence that the number of cases per day, even though we're seeing 67, there's some variability, and that variability lies between 45 and 89. So using that as an objective criterion, now we have an objective way based on the R0. In other words, how many people is an infected person spreading it to? If we base it on that, then we have a set of criteria. If the average number of daily cases, and we have to exclude active screening because that's not comparing apples and apples, but if we look at just the passive cases between the 10th and the 16th of April, and if we see 90 or more cases on average between the 10th and 16th of April, then we need to continue the lockdown. And the reason, put very simply, is that the average number of cases per day is going up.
Well, a partial lockdown for the elderly until the end of September may be on the cards. The government's COVID-19 Ministerial Committee Advisory Committee, led by Professor Karim, says this may be necessary to protect senior citizens. He was speaking at a public meeting with the other health specialists and academics in Durban.
One of the big issues we're going to have to think about is how do we protect the elderly? In particular, those above 70. Preferably those above 60 or 65, because mortality is still higher in that group. But above 70, we're really concerned. We need to think about whether it's going to be possible to have some kind of partial lockdown. And it can be a voluntary partial lockdown until the end of September or so, when we think the most of the wave of this epidemic will be over. I don't know if it's going to be over on the end of September. I'm not a crystal ball gazer, but I've just provided that as a target for now. That if we can offer something to protect our elderly, right, and especially those with other conditions like diabetes, heart disease, lung disease, we know that those three were the main risk factors in the US and in China. Those individuals, can we provide them with protected self-quarantine and self-isolation, so that what it means is that our children will go to school and they play in school, but when they go home they can't play with granny. They cannot play with grandpa because they will pose a risk to transmit the virus to their grandparents. We're going to have to protect our elderly in this period. We're going to have to build the field hospitals for the triage, especially in our big cities. And all of that's already well ahead in planning and so on. Those sites have been identified. And we need to get the staff ready. We need to know that we are going to head to this exponential curve. We need to have our makeshift ICUs, our ventilators, our PPE. All of them major challenges because the whole world's trying to get all these things at the same time.
Meanwhile, COVID-19 infections may only reach its peak in South Africa in August. Infectious diseases expert, that's Dr. Shabir Mahdi, says more people will contract the virus once the lockdown is lifted.
The peak period of circulation will most likely come after the lockdown has been lifted. And that's not because the lockdown didn't work, but it's simply a matter of there being more community transmission once the lockdown has actually been lifted. So the projections currently, including by the Department of Health, from what I understand, is that they're expecting a peak period around about August. It might be sooner.
Well, social distancing has proven effective in limiting the spread of COVID-19 in South Africa. Professor Salim Abdul Karim says the infected people only infect one person each on average. He says the practice must be continued.
We're not seeing a situation where one infected person leads to many. Why is that the case? Well, that was exactly the purpose of all our interventions. That's exactly the reason why we instituted all these things. Social distancing, hand washing. It's also the main reason we instituted interventions that led to a situation where people were not interacting with others. So when you think of a lockdown, essentially what you're talking about is that each infected person becomes a dead end. They don't transmit it to others because they're not interacting with others. So we know from that we simply are not seeing this growth in the epidemic we expected. And that right now we're not even seeing much evidence of clinical disease. We're not seeing large national increases in the amount of respiratory distress. In short, if community transmission is low, cases decline. If community transmission is increasing, then cases will increase and the exponential curve will start again.